come online so I can see you. One of you had said you were somewhere and couldn't. Let me see. Stacy, you're okay because you've talked to me and I understand that. No problem. So we are on week 2 already, and you can see that it's going to get pretty busy as you go on. You know, I do come on about at least 10 minutes early before class, answer questions, you know, give advice. And if you need any of that, please come and talk to me so that, you know, I can help you, calm you down, you know, and get you on the right track. With some questions today, we're on, you know, how do you study? And I'm very telling you that, you know, I've developed this pediatric course where I take a lot of time looking at exams, quizzes, HESEs, and NCLEX. And I look at those concepts that I'm constantly seeing within them. And I am making sure that it's either covered in my PowerPoint or it's covered in the Kahoots. So if you've come to class every week and looked at number 1, at least at interactive PowerPoint, get a little understanding of what's going to go on this week, that's your first contact. Then I'm going to talk to you about that PowerPoint, you know, giving you examples about all different things, and hopefully that you'll remember them. And that's your second contact. And then I give you the Kahoots, and it's an immediate quizzing on what you're learning. Again, if you're not understanding what I'm saying, please, please, please stop me. I will never be offended by a question, okay? My daughter made sure of this. I've been answering for 37 years, every question she's ever asked. And I think every day I see her, I must get at least 50 questions, you know, and she's a grown woman, it's very successful, but still she needs mommy to answer her questions. So she primed me for all of you. So thank you to her. So today, week 2, we're going to go over infant, toddler, preschoolers, and we're going to go into those Erikson Piaget things that you need to know. And I made sure those Kahoots had more questions on the theorists than I had last semester. So these are new Kahoots, and even the PowerPoints changed a little bit from last semester. Again, trying to get you all that information that you do need. And then we're, of course, when we're done, we're going to do the Kahoots. It is a longer one because think about these age groups. We go from a little 7-pound baby up to preschooler age 5, getting ready for kindergarten. It's a lot of growth and development that occurs during then. So if you're looking how to study, go back, look at my PowerPoints, listening to my lectures, and then also studying those Kahoots and the concepts within them, okay? So let's start with the PowerPoint. So it's chapters 31, 32, and 33. Growth and development milestones. We're going to go from infancy to preschool. So it's a lot of stuff. So biological development. This is the one that has, guys, you're going to have to help me with the transitions here. Does anybody good with these? I thought I had changed it. No, I don't. How do I stop it from going forward? I want none, I think it is. Let me see if that works.
You need to select the none and then do apply to all, or if there's already been some sets, it's going to keep transitioning.
Okay, let's see if this one worked. You know, I had every, this is funny, I'm going to be, you know, honest. Every single semester I fix it and it still comes back. So let's try it. Let's try right here. Let's wait a second before I start. No, it didn't do it. So let's go to transitions. So we're going to say none and apply to all, correct? Is that all I need to do?
I don't know what that duration time is. That's right above where your pointer is.
See, there's no way to put it down. So.
Ooh, uncheck that. Like, what is that? 3 seconds? Yeah, uncheck that.
Yeah, how about if we'll try this? Let's try that apply to all again, and let's try again. Thanks, guys. I learned something new every single semester with this. Okay, let's try again. Please be good to me. So, okay, infants, they're born. And, you saw the vital sign sheets and you heard my Kahoots that a heart rate on an infant is 140 to 160 at rest, at birth. It can go down to 120, yes, or 100 when they're really deep in sleep, but usually it's 140 to 160. And we know the respiratory rate, normal is 40 to 60 on a newborn infant. As an infant gets older, those numbers are going to slow down. That means the heart's more effective in its beating and pushing around the blood around the body. The respirations are deeper and we get all of the oxygen and release of carbon dioxide, so it works better. The blood, what happens with the blood is these hemopoietic changes, it said. So at birth, you have mom's blood. You have their hemoglobin and all of their immune is given to that baby. Well, initially, babies do not make red blood cells. And it could be 3 to 6 months out before they start making red blood cells. But you could see, that red blood cells don't last that long. They're going to be dying. So what's going to be happening to that hemoglobin and hematocrit? It's going to be decreasing. So somewhere about 6 months, you can draw blood on a infant, 6 months old, and you might have a hemoglobin hematocrit of 9, 27, 10, and 30. And it's absolutely normal. We know that we're going to be getting that hemoglobin up because then all of a sudden the body is going to be starting to make its own cells, okay? Now, this is why we do give iron fortified formulas and iron fortified cereals, because we know that these infants will need it. And depending those vitamins that the doctors give the babies, we can add iron to it depending on where it is, because we want those red blood cells, what's there, to work as best as they could. Now the head growth, we know that the whole, not just the head, everywhere is be growing. So the posterior fontanelle will close about 6 to 8 weeks. And then the anterior one, about a year, year and a half, it closes. If it closes too soon or doesn't close at all, there's a problem. So that's why we would investigate. If it's still open, the posterior fontanelle at 5 months, why? What happened? Is the inside the brain, is there swelling? Is there hydrocephalus? Is there a tumor? What's happening? And we can investigate because we know it should have closed according to these growth and developments. The anterior fontanelle, the one, that nice little soft spot that we know about 14 months it usually closes. If it closes too early, the head's growing. Is there room for the brain inside? So that could be a problem too. As they get older, they can hear better, they can see better, they can reach and they can get to that depth where they need to, because they start out with one eye and the other eye and they're not matching yet. So they can't get that depth yet. We know their brain is the most fastest growing part of the body. We know that you as an infant are born, you can't even lift a head. Your mind doesn't know how to do it, doesn't know how to trigger your muscles, your nerves to be able to hold your head up. But as the infant gets bigger through good nutrition, you're going to see them doing all those growth and development steps, raising their head, turning from front to back to front, up on their knees, crawling, creeping, walking. This is all the nervous system telling the body, those nerves and those muscles, what to do. And again, with all those things, we're going to see, are they understanding it? Can they take the rattle now, which was, first a reflex palmograph. Now it's voluntary. Can they move back and forth? Are they able to do these things? And this is all that cognitive behavioral stuff that goes on. As I said, that immune system, we know that you've got moms at birth, but then it does start to go away. This is why we start giving immunizations at 2 months old. If you've gone through the book and saw it, there's a 2-page thing on immunizations. We know that we give them at 2, 4, 6 months, and somewhere between 12 to 18 months, we're giving a lot more. And why do we do that? Well, we need to protect these infants from these diseases that could kill them because they're really, really strong. We know that the body does start forming their own antibodies, and it can protect them from it. Thermoregulation, well, at birth, what's the first thing we do with a newborn that's born? We put it right underneath a warmer. Why? They have no control on their temperature, and they have no real body fat to hold their temperature in. So that's why we put them right underneath the warmer immediately. You know, when they first come out, they are full of water, because what are they doing? They're floating in the uterus in the amniotic fluid, right? So they come out. And what happens? I mean, many of you who've had children know that when you first see your baby, they look puffy and puffy eyes, and they go to the nursery, get a bath, they weigh them, do their assessment, bring them back, and they look different. It's because they've urinated once or twice, and you're getting rid of all this fluid that they have gotten there. The kidneys, we know that, it's not 30 mLs an hour like it is for an adult, right? That's the low minimum for adults. For infants, it's half an ml per kilogram per hour. So it's really smaller amounts. Now, how do we measure urine output on an infant? We are not going to put a Foley catheter in every infant to look at it. So where do they urinate? They urinate in a diaper. So how will you know how many mLs of urine? Well, size 1 diaper weighs 30 grams. So you take that size 1 diaper off the infant, put it on the scale, and let's say it weighs now 60 grams. The difference between the wet and the dry diaper is urinary output, ml to gram. So it's really easy to be able to measure the output on a child. At birth, their GI system is immature. That's why we don't feed them initially. And if we do feed them, you're going to see it come right out and be in the stool. A lot of times you will see sometimes in those reflux babies, someone who keeps spitting up, they might say, put a little bit of cereal in the milk to hold it, thicken that formula. You're going to see that cereal in the stool. It's done its purpose by thickening the milk that they're going to drink, but they cannot process it yet. We do not start feeding our children till about 6 months old, and then we will start them between 4 to 7 days, one at a time. What do we start with first? Well, they say rice cereal, but every physician, pediatrician has what they want. Now, there's 2 types of development. There's fine motor, which is fingers. And then there's gross motor, and I call get up and go, 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 like Paw Patrol. That's gross motor. That's movement, okay? So fine motors, we know that they should be able to grasp an object by themselves, okay? So we know first is reflex, and then we know it's voluntary. So that voluntary happens between 2 to 3 months. Then we should be able to take that and go in between hands about 7 months old. Also, there's something called that pincer grasp. We talked about it in a Kahoots last week. It's the finger pinch. Okay, now it starts with crude, which means it could be a couple fingers getting those Cheerios or those puff balls off of that eye chair, but it comes into a real fine pincer about 10 months old. Then we should remove those blocks, contain whatever those objects are, out of a box at 11 months old, and they should be able to build a tower 2 blocks by 1 age. And this is looking at their fine motor dexterity. So this right here, again, is a little test for you as you go back and look at for your exams. So gross motor, get up and go, 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 right? So first is what? I told you it's the head. At first, you have to support the head and the neck because their head will just flop, and if you don't hold it, they will flop backwards or forward. So maintaining that neck and head control is because they don't have that control. Well, then they start getting it. By 5 months old, they should go from abdomen to back. And by 6 months, they should be able to go back to abdomen. So let's say you have an infant 6 months old. Would you put that child on a couch, go get something to drink and come back? No way, because what's going to happen? They're going to roll off, right? So knowing growth and development, what a child can do, can help you care for that child and keep that child safe. By 8 months old, they should be able to sit unsupported, no pillows and stuff and toys around them. They should be able to sit. Then they should be able to go from their back prone to sitting up about 10 months old. And then it goes into creeping and then of course walking. So nutrition, nutrition, nutrition. The most important thing that we do for our children is to feed them properly. I've had many parents say, well, my child barely eats. So I'll say, so tell me, are they up to date on their growth and development? And they go, oh yeah, they say he's advanced. I said, then your child is getting the proper nutrition. Cognition, nutrition, they match. If they're not getting it, they're not going to be where they should be. So first 6 months of life, only human milk, breast milk or iron fortified formula should be it. After that, we start giving them the foods, like I said, introducing one at a time, every 4 to 7 days apart, looking for any allergic reactions to them. Breastfeeding, just on both breasts, 8 to 10 minutes, they say is good. Now, when a baby is born, they have all that extra fluid, like I said, right? They're in that amniotic fluid and they're puffy. You will have an infant lose about 10% of their body weight from their birth. And then they start gaining really, really quickly. Infants can go up to, 15 grams or a half an ounce every day for the first 2 months of life. So they can be born at 7 pounds and all of a sudden they're 8, 9 pounds within 2 months. And that's absolutely normal. Also, we're giving vitamin D. Vitamin D works on muscles. They're good for joint and muscles. What are these infants doing at this age? They're starting to learn their muscles, their neck, rolling, sitting, crawling, all of these things. So giving them vitamin D, that's why we do that. So what do we give? As I said, it doesn't matter. There are some trains of thought that says rice cereal first, but there are pediatricians, like I said, no, start with some bananas first or sweet potatoes. So it all depends on that. And what this is these infants at 6 months old are starting to drink a lot more milk, a lot more all the time. So they need something else to supplement it because mom, is just giving off so much milk or they're drinking so much formula that we want to give nutrition in a better way. So it does wean them off the breast. It does wean them off the bottle, and it gives actually mom a little bit of break. We introduce whole milk at 1 year old, okay? And whole milk is what they say to give these children at 1 year old. So you have a baby, it's gonna get some teeth. Some baby gets teeth at 6 months old and some babies don't get teeth, like my children and my grandson didn't get them till 15 months old. They didn't get one, they got 6 at the same time. That's normal. It could be at 6 months, you see teeth coming out, or it could be later on. As long as you see them there, ready to come up, it's okay. So we do just a toothbrush or a warm wet washcloth, and we just rub the teeth just to get them clean at the end of the day. When fluoride doesn't get introduced till 6 months, which is your toothpaste. So after that, remember, if they're in a crib or if they're laying down, not to prop any milk or juice or whatever, because that's sugar and it's going on the teeth and it can cause a lot of decay. Pacifiers, there's been so many back and forth. Is it good? Is it bad? Well, the new train of thought is yes, it is good. And it does help prevent SIDS deaths because, that pacifier does work good. Now, how many teeth should a kid have? Well, it's the age of the child in months minus 6. So 7 months minus 6, they should have 1 tooth by 7 months, okay? 8 months, 6 minus, 8 months is 2 teeth. So that's the way it should be according to textbook. But we know it's not always like that. Sleeping patterns, they should be sleeping all night long by about 3 to 4 months old. There are some parents that wish their children slept more than 4 hours at night, but again, children are all different. We know that infants at birth, most of the time they should be sleeping and wake up for awake times, and then they're napping and sleeping, waking up to sleep. Should we have them in a walker, a swing, a playpen? Well, they're not necessary, but many parents will put them in a swing so they can watch them as they're going around and, doing chores, making dinner, whatever, and figure that swinging is a nice motion, but it's really not necessary. As I said, immunizations. I mean, do we have a gob of immunizations for these children? Well, we know Hep B is the one given in the hospital, first one. And then we know as they get older, they're going to have more. The one thing I can tell you about immunizations is if you have a child who is born and let's say we determine they do have an autoimmune disease, like let's say we know that they have sickle cell disease. Because both parents had it. And so we're testing the child, and yes, they do. A lot of times we are not going to give live vaccines to children that are immunosuppressed or if they're on steroids. And we're on steroids a lot as we get to be toddlers for upper respiratory group. So remember that, same as adults, same as children, that'd be the one time that we would withhold an immunization on a child. Colic is probably one of the hardest things that a parent can deal with. This is a child who screams all the time. You can really have a hard time to soothe them, and it's a lot of gas. And it takes a very patient mother using many different medications, holding them all the time, rocking them all the time, using swings, using whatever they can to try to have them sleep. It's hard to see your infant crying when you know they're in pain, but you've done everything for them and they're still crying. Another thing that can occur in infants is failure to thrive. Well, I'll ask you first, how would you know a child was failure to thrive? Well, if at 6 months, that infant has not doubled its birth weight and born at 6 pounds and they're only 10 pounds now, that's a failure to thrive. They should be at least 12 pounds. So what do? Well, we're going to find out why. Is it a metabolic problem? Is it, the dietary? Is it an allergic thing? What's going on with the GI system? So it will take, at that point, we'll do early intervention by looking at the kid. What do we need to do to find out why they're not getting the nutrition that they should? There are other health problems that occur. And I mean, I think the first one you see is the diaper rash. And infants get it many times. It could be due to, and the one thing I've always found out is the type of diaper. I know that my children did not like Huggies. My grandson could not wear Huggies. He could wear Pampers and he wouldn't have a rash. Now, rashes also can be caused by what mom's eating in her breast milk. Or it could be, you went on a trip in the car, the baby was sleeping, didn't want to wake him up, and, the diaper was on too long and could cause rash. So how do we treat these? Well, it could be putting some nystatin cream if it's a yeast, or keeping it open to the sun, frequent changing, and just cleaning the area with cool water and soap if we need to, if it's dirty that way. One of the things infants get, especially today with back to sleep, SIDS say you must go to sleep on your back. It has decreased the amount of SIDS death on infants. So we recommend it highly. But what happens? The back of their head gets flat, right? Well, infants' skulls are so soft and malleable that we can put them when they're awake, wide awake, tummy time, get them off their backs. And actually, it does help those scalps round out and be much better. So just position this child on their tummy. Many times you'll see the physician wants to put them on these little helmets like this little boy here, and that helps round out the head too. But there's many different ways. So also something called cradle cap. Some infants are born with this crusty stuff on their head. How do we get rid of? Well, you're not going to get rid of it in a day, but just wash them with warm soap and water, then take a little fine comb and just brush it gently. And eventually we'll get all of that, scalp off there. As I said, SIDS, SIDS can be caused for many reasons. What would that be? Well, sleeping on their tummies. So back to sleep is what we want. You have a gender thing. More males than females die from SIDS. Smoking in the house can cause SIDS. And what if that kid just had a little upper respiratory, a little, mucusy noise and a little nose and a cough? Those are things that can cause SIDS death. Those risk factors. There's also something called an ALT-T, or an apparent life-threatening event. Usually what this is, you have a reflux of food that goes up and it, burns in the throat, and the child holds their breath and they turn blue. And these parents bring these children in. My kid, he turned blue. Oh my God, I don't know what to do. I had to this, I had to that. Well, what they'll do is, and they call it a near miss SIDS, or the ALT-T as I call them. But these children will be admitted and they will be worked up for that GI problem or even neural problems to see if there's anything going on. And then they'll be sent home with an apnea monitor. These apnea monitors are pretty cool. They're just a Velcro strap with 2 leads that are attached to it, and it goes to this monitor. And if the child's heart rate or respiratory rate goes below the alarm, it is an ear-piercing sound, so that, number one, hopefully the child will jump from the sound and it will waken the parents so they can go in and shake their baby and wake them up. So Latasha is a breastfed infant being seen in the clinic for her 6-month checkup. The mother tells the nurse that Latasha recently began to suck her thumb, which of the following is the best intervention? What would you do? Are they allowed to suck their thumb?
Anybody?
I would say
They're
no.
allowed to suck their thumb.
I would say C.
What if I talked about Oreo Sensorimotor? It's in the mouth. What does in the mouth do? It's self-soothing. They calm themselves down by oral satisfaction. So putting the thumb in the mouth isn't bad. So it's normal. Is it better, a pacifier? Yes, only because of positioning of the mouth and the teeth in the future, but some sucking is normal. So we're going to go over some of these here, and we're going to go over these theories here, and we're going to go over them in the Kahoots too. So Erickson, one of the things and one of the questions that's on your NCLEX and all over the place is Erickson. Erickson is the big one to understand. So let me make you understand what this means. Every single level, you have infants, toddler, preschool, school age, adolescent. Those are your areas of childhood development, those little names of difference. So infants, well, what do infants do? They eat, they sleep, they pee, and they poop. What do they want? They want to eat, they want to sleep, and they want their diaper changed. And they want mommy to hug them, right? So when you develop a sense of hug, all those things are being done for them. That means they cry, they know mom's gonna come, or the caregiver, dad, whoever, is gonna come, pick them up, change their diaper, feed them, hold them, bounce them, put them to sleep, lay them down. Their needs are met. Well, what about that infant who's not getting those needs met? Which means this child cries and cries and cries and nobody comes. And sometimes these children, it happens so frequently that they don't even cry anymore because they know nobody's coming. And that can happen in a home of abuse. So knowing and seeing an infant's response to, the wet diaper and the hungry, and do they respond that way, can alert you to maybe there's something going on here. Piaget, sensorimotor, and this is the beginning of Piaget, that sensorimotor. Again, this is all about doing, imitating. I know I can take a little 2-3-month-old baby, stick my tongue out, and that infant will try to imitate that. Or I try to shake the rattle when they're a little bit older, like 6 months. They're going to try to do it. They are trying, they're playing, they're taking things, touching, feeling, mouth, shaking. These are all part of what Piaget's sensorimotor is all about. And they're trying to figure out, like, why does that make noise when I shake it? They also are starting to look at themselves. You know, many times we have mirrors in the crib, or we have mirrors on the floor, on the back of the bathroom door, wherever. And, you know, these children are looking at themselves. They're starting to see who they are. We talked about object permanence last week. It means even though you take a toy away or something, an object away, the child, the infant still knows it's there, and they go searching for it. They are getting more motor ability with the playing. They're being able now to get on their knees, they're crawling, they're moving their head, they're reaching. All of this is starting to develop. We know children many times, you know, do not want to leave mom and dad's arms. I think we hear this where first day of daycare, you're taking your child to the daycare and you give that to the caregiver, and the infant turns and puts their arms out and don't want to go and they're crying. This is separation anxiety. So yes, this is hard to explain to an infant, but again, what do we need to do is, again, keep their trust, know that their needs are all going to be met. By 6 months, you know, it becomes more of this stranger fear. You know, many, you know, family members you haven't seen forever, they come in, oh, there's James, let me give him a hug, pick him up, the kid screams, wants to go back to mom, and you're like, what happened? Well, they don't know who you are yet. So that's stranger fear. And now they're starting to look now, like, who are you by about 9 months old? Their language develops. They start with coo and crying, and then they start with mama, dada. It's like what are they going to say first, mama or dada, or mom or dad, or nana or pop pop? Who is it? So that's part of their development. And then, of course, you know, their voice is always heard when they're crying. They're going to be playing, which again helps their cognitive development. There is ways that we can measure temperament, and there is temperament questionnaires in case we need to do that on some children. So the toddler, ages 1 to 3. This is your terrible two. I call these the dive bomb kids. You've heard me say that before. They get on the couch, they get on top of the back of the couch, and they jump over to the other couch or on the table, and they miss and they fall on their heads. And, you know, they are trying to do things by themselves. And this is what we call that intense period of environmental exploration. And I love this Jerry Seinfeld saying, it goes, having a 2-year-old is like having a blender without a lid, because they're everywhere, you know, trying to keep up with them. You looked at them, they're on this side of the room, and you look again and they're out in the room, they're somewhere where they shouldn't be. So it's full of temper tantrums. It's that no, 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 and me. They're very into themselves. When they're toddlers, everything slows down. So the first year, they've tripled their weight by 1 year old from birth. So it slows down now. So we should be quadrupled about 2.5 years. You don't need to know those things, but that it just slows down. We know their height slows down. It's 3 inches a year. And now we get what I call it's called that step-like, but they get a little pudgy, then they grow. So they get pudgy, they gain a little weight, then they get taller and get skinny. And then they gain a little weight and they get taller and they're skinny. And this is part of it. Their head was born huge, according to their, comparing it to their chest at birth. By the time they get to be toddlers, about 2 years old, we know that the head should be equal to or less than their chest. Again, another growth and developmental thing that we look at, because if it's bigger, guess what? We need to find out why. And they say at age 2, they should be half their adult height. Their body systems, they're going to be getting more mature. They're able to, you know, get infections and viral infections, and they're building their immune systems. You know, their GI is able to tolerate a lot more foods, you know, and they're starting to be able to urinate in the potty, and then hopefully by 3, if we're lucky, they're also gonna, go have their bowel movements in the potty instead of into their diaper. We know upper respiratory infections, otitis and tonsillitis are common. Why? Well, most toddlers have to be in some sort of daycare. And if not even, we know everything goes in the mouth. So I call daycare the swapping spit. From one toy to another toy, everything in the mouth, they're hugging, they're licking, biting each other. And this is that swapping of germs. And everything is short and straight. Eustachian tube, short, straight, big adenoids, big tonsils. All of this causes the increase in upper respiratory infections. So toddlers, they're starting to get a little bit better. But usually, the way they walk and falling over and you're like, oh, I'm gonna catch them, gets a little bit better by about 2 to 3 years old. They're able to use right and left arms. And by 18 months, they should be able to throw a ball, that it's a definite, take the ball, throw it, they'll do it. They're visual. Like I told you at first, they first have one eye and one eye, it's this biocular. Well, now they're together, and now we're going to have better depth perception. This helps a lot with some motor coordination. So we know one of the things that they do, as I said, is falling. Now, they're starting to realize that formula and that baby food that you gave them was horrible, and they don't want to eat it now because their taste and the way that their mouth and the textures in it, they don't like it anymore. Where they used to like bananas, they don't like that anymore. Where they used to like, peas or something that you were like, well, now they're realizing it doesn't taste good. So now they become extremely picky eaters, especially by the end of toddlerhood, by about 3 years old. They love to explore the environment. They like to play with their food. They like it everywhere. And actually, this is good. Again, sensorimotor. This is what they love. This is calming. This is stress relieving. So Erickson, as I said, is part of no, 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 me, and doing the same routine every day. It is hard to take a toddler on vacation because they want to get up at the same time. They want the nap at the same time. They want the same bath, the same food, and on vacation be hard. That's that ritual. Preschoolers are easier, but toddlers, ages 1 to 3, that's what they want. Now, toddlers, according to Piaget, they're starting now to do things to experiment. It could be taking a truck and putting a ball in the back of it and spinning it around, and it works. It is trying, it's that play working, figuring things out. And now they're going to other places. Maybe they find, a car that has something that they could stick a doll in or whatever. And they're doing those things, and it's part of that. And they're starting to learn around and watch other kids. So that's basically what I said here. It is just absolute another thing for you to look at regarding your Erickson. Sensorimotor, I think this is a really good one. So they like to do things that are good, like sucking their finger. When you have an infant start shaking the rattle and you go, oh my goodness, they're playing with a toy, they're shaking it now. They're going to do it again because they heard you and they know that. And you don't think that they understand? Newborn infants can control you very easily and very quickly. Those tertiary circular, well, mom's in the kitchen, let's say fixing her dinner or getting you something else to eat, but you didn't want mom to leave. But you knew if you threw your bottle or your sippy cup on the floor, what's going to happen? She's going to come back in and pick up that sippy cup and give it back to you and say, hey, what'd you do that for? Don't do that. And then, of course, if you want them again, what's that child going to do? You're going to throw it on the floor again. It's part of tertiary circular. Toddlers do start, understanding that they have body parts. They're into potty training. So they watch mom and dad going to bathroom in different ways. So they start touching themselves. Normal, let them do it. If they're doing it in inappropriate places, just say, don't do that here. You know, it is part of the exploration. They do understand by about age 3, there's boys and girls. There's boys things, there's girl things, and you're going to see that identity growing. They're going to understand that everybody is start looking a little different. You know, they may not have the same color skin, same color hair, same color eyes. They're starting to learn that there is differences. They're starting to want to do things that makes mommy and daddy happy. These toddlers are actually pleasers. They are starting to understand more words. They can put more words together, bigger sentences. They want to be independent. One of the things with toddlers, you need to let them try to do things. And if they fail at doing them, that is okay. As long as you let them do it, it's something that's not going to hurt them, okay? They want to try to feed themselves, even if the spoon's upside down, it's okay. This is that exploration that they're learning. They are going to be playing by themselves. They're going to be dressing themselves, and they're going to come in, you know, they went pee-pee in the potty, they come in and their shorts are on inside out and backwards. Well, they put the shorts on. It's not that it's inside out and backwards, and should be commended for that. And they're starting to understand feelings for others. I know my little grandson, I was having a really bad RA flare and I had ice on my knee. And he came over, he was about 2.5, and he went down and he kissed my knee and he goes, all better. So that's what toddlers are. So these children need, you know, they're getting more and more physical, able to do more things. They're able to work with other children, and they really need to see what other children are doing because they're learning from that. Again, they are going to go through the play, whether it's playing next to someone, imitating someone. It could be the princess, right? Everybody wants to be, you know, the princess. And of course, you know, feeling things are very important. Toilet training, you know, they need to show that they're ready. This picture of this little boy going pee-pee on the potty backwards actually saved me a lot of wet floors in my bathroom with my grandson, because he lived with me up till about 3 years old, and we would put him on backwards, and you know, they could get it in there. You turn him around, it goes up and it goes over on the floor. So I thought that was a great picture, and I'm sharing a personal thing with you. Sibling rivalry is huge. You know, children are always want primary attention. If they have a new sibling in the bunch, need to get them involved with that, whether get me a new diaper, get me a burp rag, you know, having them help. Temper tantrums are huge with toddlers, but many of them don't want to go to bed at night. Now, another book, you know, lay down, you know, you don't want you to leave, et cetera, et cetera. Again, no, 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 me do, me do, me do. And they really are wanting to try. Now, if something happens in the family, you know, whether it's, you know, the cat got lost or the dog died or grandma had to move away or something that really affected them, they will regress, and they might go back to, you know, wetting, you know, their pants, being incontinent when they've been potty trained, or maybe they'll start sucking their finger. This is a normal reaction to do that. So they'll start refining their coordination and they'll start throwing the ball. And again, you have your answers there for you to look at. So let's look at the toddler. At 1 year old, they should have one-word sentences like mama, dada, milk, more. You know, sometimes we're now using sign language, which they really pick up pretty quickly. By 2 years old, it's multi-sentence words, you know, and they're starting to be able to express themselves. Again, they're feeding, playing, dressing, and undressing themselves. Car seats are important. We know at birth, what are they? Well, car seats should never be older than 6 to 10 years from the date of the manufacturer. And if you don't know, there's always something that we can refer these children to. Infants should be in the rear seat, rear facing up till 2 years old. And then you can turn them around, in the rear seat at 2 years old. Car seats, you can borrow your friend's car seat, as long as it's not old. And today we've got so many pediatric facilities that they are offering putting your car seats in to make sure they're put in correctly. So preschooler, ages 3 to 5. This is that change where they're starting to get prepared to go to school. This is preschool. And what does preschool mean? Well, it means that, my grandson stayed with grandpa. Pop had him for the first 3 years of life. And now he's going to go to preschool. So what did he have to learn? Well, how to get along with other children, not just one or two, but a whole bunch of children. And you have to learn how to listen to the teacher because you're away from the family. So it is a difficult time for these children to go through, and they need to be able to sit and to listen. Their physical growth slows down, everything slows down. They don't gain weight again. Their height's not as much. And again, these children can adjust to moderate stress as long as you explain what's going on. Taking them on vacation isn't as rough as that toddler, but they can handle stress a lot easier. So gross motor, get up and go, right? Walking, running, climbing, and jumping, they can do all those things. In fine motor, they can now start coloring. They can start getting in the lines. They also can get themselves dressed, and they love to draw. So Erikson is all about feelings of guilt and anxiety, which means if they do something that they didn't know was right or wrong, they're going to feel bad. Or if they've done something like color on the wall, and then you didn't see it, and all of a sudden at dinner time, which this happened to me, this little preschooler says, "I'm sorry, I drew on the wall. I shouldn't have done that." So he was actually, that conscience, his super ego was making him tell me that he had done something wrong. They're pleasers. Again, they want to please. And again, they're learning right and wrong, and again, they know the consequences from that. They're getting ready for school. They're getting ready to go to kindergarten. How do we get a child ready for kindergarten? Well, number one, as parents, we need to teach that, learning is great. You have a positive attitude. These children should be read to, books every day. I'm lucky I have a daughter who loves to read. This grandson of mine gets 3 or 4 books every night. And even this child at 2 could recite planets because that planet book was read so many times to him. I don't even know the sequence of planets, and he was teaching me. So I thought that was pretty cool. Also, they should be in other activities with other children, whether it is going to a gym or going to some sort of sports or dance or, library club, something. You need to get these children with other children, and it gives them that opportunity to learn how to work with other kids. So Piaget talks about they are starting to learn. They are starting to know that if I do something wrong, something's going to happen to me. They're going to be able to express themselves better, and they still don't understand the clock per se. They don't know at 4 o'clock we're going to go here. Well, that means nothing to a child. It means after nap time, when you wake up, we're going to go to Nana's house. Or tomorrow when the sun comes up, we are going to go on a car trip. So they know it according to an event. They don't know the clock. And they're in this totally magical thinking. Ever listen to a preschooler playing by themselves? They're talking to themselves. And that car or that doll is floating around and they're making forts and all this stuff. And that's all part of cognitive development in Piaget. Now, Kohlberg. Kohlberg is about right and wrong and a consequence for either. If you do something wrong, you know you're going to get timeout or something's going to be taken away, something. But if you do something right, they know that they're going to be praised. But they also know if they do something wrong, they knew it was wrong. Was it worth being wrong to be punished for? So they're starting to think a lot more about this. So they know the punishment. All right, okay, but I wanted. Sexuality. Now, we know boys like their mothers and we know girls like their fathers. Seems to be what they do like. Also, they're starting to get out, I'm getting dressed, or, they're in the bathroom, they want you to leave, go out. They want to dress like mommy or daddy, or I know my daughter used to wear my shoes all over the place, my high heels, and you hear this clicking come down the hall. I mean, that's just part of what they do. And they're also into more sexual exploration. There has been times where a child might be in a room and they have a stuffed doll and they're rubbing against their genitals, okay, which is normal. Masturbation is normal for these children. So what would I do? Well, I'm just going to walk out, say, I'll be right back. I forgot something, and come back, because it's a normal exploration. They don't need to be punished for that, okay? And then there's going to be questions about sexual reproduction. Remember to ask sort of what they know first before you give all of the details. So they're not, as I said, a lot into that ritualism or needing the same thing all the time. They're not into that no. They as much. They can dress themselves. Again, they're starting to please. They have values of the family and what their culture is. They understand, in their own way. I mean, they might understand for instance, let's say your Christmas is a big tree and lights and presents, and you go to church, and when you come home, you get to open something, and then you go to sleep and Santa Claus comes. Well, they're starting to understand those values, whatever you have taught them. And also, they are going to start to challenge you. This is when, no, I've got 2 more minutes before I have to go to bed. And you're like, no, you need to go to bed now. They're going to start challenging those things. Your different plays again. Associative play means you play together, but there's no rules. They imitate play. They play with imaginary playmates. Even by themselves, you hear them talking. And then there's dramatic play and there's mutual play together. So plays are so important. It really helps with their creativity. They are afraid of the dark. All of a sudden, it was age 4.5, I think it was. My grandson didn't want to go into his room without the light on. Even though there's 16 lights to put on and it's glaring bright, he just didn't want that dark. Did not want to be left alone. And he does not like dogs. He's afraid of them. They're come after him. Never had an experience with one, but it's part of it. And they talk about ghosts all the time. I think this is something that kids, they do together. They're also worried about their body parts, losing their body parts. And they're also afraid of people associated with pain. Who is that? Nurses, doctors, right? Because we do inflict pain. So that's why we're trying to be as least pain as possible for these poor children. So again, this is the same thing. Sex education, make sure you know what the child thinks before you give information, and you should use the correct anatomical words. You have a penis and a vagina. It is what it is, and I know many cultures have different names, and that's okay. But you should, so that there's consistency between everybody. Be honest with them as much as you can. And again, masturbation is normal. Make sure, go to your room and do it in there. Don't do it here in front of everybody, right? Just send them away. And again, the fears, just what I read. So are you ready for a Kahoots? A lot of information, isn't it? So it's a 57 question Kahoots. So Jose, Stacy, and Victoria, you still with me?
Yes, I'm here. I'm just leaving the doctor's. I was trying to send you an email.
Okie dokie. Stacy, you around still?
Yes, I'm here.
Okay, you're in a car. Never mind. Turn it off. Good. Thank you. Just making sure, guys. I want the best for y'all. One 1807. Which factor predisposes toddlers to frequent infections like ear infections, tonsillitis, and upper respiratory infections? I mean, no, a lot of the factors are that swapping spit and everything in their mouth, but it really is those short, straight structures, eustachian tubes, that big tonsils and adenoids, which clogs the mucus there, which forces it up and drips on the trachea. And that's all part of toddlers, you know, and of course, with everything in the mouth. Remember, if you don't understand something, please stop me. What type of play is considered cooperative play? So cooperative play is when you get together, you make goals of what you want and how do you win, like playing checkers or a board game, okay? Cooperative means there's a goal. It isn't just random playing together, making rules as you go. It's organized. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning, what? So whenever you hear Kohlberg, Kohlberg is right and wrong and consequences for either, okay? That's the way, the context, you will always see that. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So you have a 4-year-old who needs to go in and needs to have, let's say, their ears done, tubes put in, and they go in for teaching. What would be what you would do? So again, use a doll, show what they're going to do, you know, touch their hand and say it's going to hurt just like this, touch, no pain, we're going to do this, this is the way you'll feel, etc. Using a doll is non-threatening, and they do listen very well. A multi-select. What are some findings from a pediatric physical assessment? Remember, there's a history and there's a physical. Okay, remember when you see these questions, this is the physical assessment. What is part of physical? So physical is growth and the review of the body systems, listening to the lungs, you know, the bowel sounds, etc. Symptoms are more of a history of when did it start? What have you seen? What fevers have you had? That's all the part of the history, not the physical. Before performing a physical assessment on a toddler, the nurse should do what? To encourage cooperation. So you have a toddler, ages 1 to 3. You need to go in and you need to take a blood pressure and you need to listen to their chest. Well, let them play with your equipment, play with the numbers, make numbers up, have them push buttons, do it on you, whatever needs to be done. And that taking 2 to 3 minutes saves 20 minutes in time every time. What would you suspect if you note that an infant's chin is quivering, their fists are clenched, and they're inconsolable? And this is clearly what we call pain. You know, we're talking about, you know, this inconsolable, unconsolable. You can't calm them down. And that chin and those fists like this, that means they hurt somewhere. And sometimes the way they rock their head, it could be an ear, or maybe it's something else. They can show you things. If you just got to look at them. A multi-select. Erickson describes infants as trust versus mistrust. What does trust mean? So the infant feels secure because they can predict what is coming and they are a happier, calmer child because they know if they cry, somebody's coming for them. So that is Erickson's trust. The mistrust is completely opposite of that. They're not secure. They're not happy. They're fussy children. A 3-year-old child is having an outpatient procedure. How would you help the child to be less fearful? And we're just going to use that doll and we are going to show them where we're going to touch, we're going to feel things, okay? That doll is better than an explanation. They don't understand unless you point it out and show them. They're 3 years old. You have to show them. They don't know a lot of that yet. You need to do an assessment on an infant and you walk into the room and the infant is asleep in the mother's arms. What do you do? What you're going to do is, this kid's quiet. You know, infants, when they're awake, they're always cooing or they're moving and you touch them and they're wiggling. It's hard to listen. You can hear that lungs, the best breath sounds, and you also can listen to the heart and heart sounds. So if an infant's asleep, listen to their lungs and to their heart. It's the best time to do it. When do you switch formula to whole milk? So it is 12 months old that we should take them off formula and put them on milk. And this is what they need. And they do need the fat from the whole milk. That's why they say whole milk, not skim milk. A multi-select. When and how do you introduce solid foods to infants? So the picture of that baby with food from head to toe is why my children always had a bath in the evening after they had fun. You know, let them feeling and touching. And this is again, that texture, that sensor odor motor, everywhere it went. So you introduce foods at 6 months. You do it one at a time, and you should wait actually 4 to 7 days before adding another. I didn't check that one. I apologize. That was actually a new question I threw in there. And do we add stuff together? No, one food at a time. What were they allergic to? Was it the fruit or was it the vegetable? Before assessing a 4-year-old child, what techniques would you use to approach this child? This is a preschool child. So the way you get to a 4-year-old child is not talking to them about what's going to happen first. No, first gain their trust. Hey, you got Batman on. That's cool. I have a Batman shirt, or I would like a shirt like that. Or maybe they have beautiful red curly hair. Oh, I love your hair. Oh, your eyes are gorgeous. Do those sneakers run fast? So doing those questions, now the child does not feel threatened, and then they're going to listen to you when you show them what you're going to do with a doll or something, or let them touch the equipment. They're more apt to do it. So get on their level, look at something about them, talk to them, and you're going to be able to touch that child a lot easier. They won't be as scared either. What technique can be used to examine a toddler? Ages 1 to 3, what would you do? So you're going to use play with whatever it is. It's about their body parts. So where is your ears? Oh, can I look at that ear? Oh, look at that. I can see out the other side. So again, we're using play. We're assessing what we need to assess, and the child's going to be happy. Again, getting on their level first. Let them touch the equipment first and then use the play. When assessing a healthy child's lymph nodes, what would you expect? You should not be able to feel lymph nodes on a healthy child. If they're sick, that's when they're going to be able to feel them, okay? So kids sick, feel them. Healthy, you not at all. Which Erickson stage of development levels would be used for a toddler? So we know trust versus mistrust is for infants. And it's autonomy versus shame and doubt. Toddlers, you need to let them do things for themselves instead of it's easier for you to do it, like dressing them sometimes or helping them brush their teeth. Let them try to do it. And they're not going to be as shamed because you didn't let them do it, and this actually promotes a healthier child because you've allowed them to do things, and that doubt is, I want to try it, but mom's not letting me do it. So let them do what they need to do. It does help a child feel more independent and secure with themselves. What pain scale would you use on a 3-year-old child? This is faces, okay? It starts preschooler for the pain scale that we use faces. FLAC is from 0 to 3, and then it's for nonverbal children that are older. So faces is from preschool up. Numeric is age 8. according to the book. A multi-select. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So what it means is that shame is when you as parents do not allow them to try to do new things because it's easier for you to do it, or you're afraid they might get hurt. It's better to allow them to try things, and then they're not going to be, feeling this shame. They want to, but they can't. They're not given that opportunity. When walking into an exam room, you see a 2-year-old rubbing a stuffed animal on their pubic area. What do you do? So don't say anything to the child, walk out and say, I need to get something, I'll come right back. And that literally doesn't allow that child to feel shamed for doing something that's absolutely normal. All young children do that. A 2-year-old boy is playing with mud and dirt. What type of play is this? And that is sense pleasure. It could be like building sandcastles too, right? Anything that you mold, you play, and you construct to put together is part of the touch. It's that feel, that sense, the texture of it in their fingers. They love it. A parent of an 18-month-old boy says that he says no to everything and has really rapid mood swings. No, 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 mine, 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 mine. Again, it's your toddlers, absolutely normal about it. I just absolutely ignore the behavior and go to do what we need to do anyway. What is descriptive of the preschooler's understanding of time? So they don't know time by the clock, but they do understand time by an event. After the nap, we are going to go to Nana's house. When the sun comes up in the morning, we're going to car for a ride. So it's time is associated with events. A 4-month-old infant is crying and shaking their head. What feature of pain is the infant showing? And that's the location. Probably is an ear infection. Something's going on with their head and they're trying to get away from that pain. That's the location. And sometimes that's how we determine what's happening, why a child doesn't feel well. A 1-month-old infant's back of their head is flat. What would you tell the mother? I mean, today with SIDS and back to sleep is the recommendation. So position that infant on their tummy and do tummy time while they're awake and alert and active, because their skulls are still very soft. They're not firm, and hard. They're still soft and they do mold very easily. Infants crawl before they walk. This pattern of growth and development is called. They lift their head before they turn over. They turn over before they get on their knees and crawl. They crawl before they creep. They creep before they walk. What is that? And it is called sequential trends. It's what's going to happen in what sequence. Again, it doesn't matter if they never turn from belly to back, but they go back to belly and right up on their knees, as long as they're going in a forward pattern, and that's called sequential trends. How do you communicate with parents that do not speak a language that you know? So we definitely should use the telephone interpreter. We cannot have any part of the family do the translation because they will not translate it verbatim. They'll put their inflection of their feelings into it. So it's never a family member. If you have a staff member that speaks the language, okay, that's the second choice, but the best actually is that telephone interpreter. And today, many times you're not going to have time to help another person do translations that take time. What age would most children could understand under, on top of, besides, in back of, around, over, under? Your shoes are under the couch. And that's about 4 years old when they start to understand these sort of things. Before that, they don't get it. You have to show it to them, you know, the first times, and then they start learning what those adjectives mean. In terms of language and cognitive development, a 4-year-old child would be expected to language and cognitive in development. So you tell a 4-year-old, go put your shoes by the front door. You take your clothes, put them in the laundry. Simple commands they're able to do. They do not understand abstract terms, or they don't understand conservation of matter. They always think, yeah, that wasn't the last icy. I know there has to be more. They don't get that. And they don't understand what somebody else is thinking yet. It's way too young. How would you assess the pain of a toddler? And that is the Flack scale. So I've asked you this question in 3 different ways. I think now that you're understanding Flack and faces, the 2 ones that are switched the most. What safety instructions would you teach the parents of a 6-month-old child? Multi-select. So we are going to introduce food one at a time, 4 to 7 days apart. So that's wrong. So it's rear facing, cover those outlets, and do not lay that child somewhere where they can roll off. 6 months, they should be able to turn front to back, back to front, and they will roll off. I've seen many a parent come in with a kid who's rolled off the table. Multi-select. What are the cognitive characteristics of a child ages 2 to 7 in the pre-operational stage? How do they think? Cognitive. How do they think? And it's all about me, 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 me. So it's their ego is the center. So they're number one. They can play next to someone and they're extremely imaginative. They don't know why things work yet. They're not into the logical yet. That's far advanced. They right now just are learning that a car, what it does by playing with it. They don't know what happens after that yet. A nurse receives a phone call about her 6-week-old baby, and he's crying a lot every day. What can she do? She's asking the nurse. What should the nurse respond to this mother? So a 6-week-old baby who's crying every day needs to be examined. Why? Could be many different things. It might just be colic, might just be reflux or something, but you can't determine that on the phone, especially on a 6-week-old baby. 6-week-old, they're still immunosuppressed and they're very fragile. That child needs to come in, needs to be examined. A multi-select. What should an infant be able to do at 9 months old? So they should be able to hold a rattle by themselves. They should be able to roll completely over and pull themselves up and, creep around. They should be able to sit without support at 8 months old. So they don't need support. That's why that one's wrong. The first expected fine motor developmental milestone for an infant begins with, remember, fine motor F fingers. So the first one is that reflex palmar. Okay, then it goes voluntary, then it goes into pincer grasp, and then it goes into putting it into containers. So yeah, first thing is that reflex palmar. A toddler's parent asks the nurse for suggestions on dealing with temper tantrums. Remember, me, 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 mine, 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 and they love to throw themselves on the floor. I remember doing this in the grocery store with my parents so many years ago, and she would just go to the next aisle and leave me right there. But remember, I was number 6 out of 7 kids. Anyway, ignore the behavior as long as it's not going to hurt themselves. Okay, just don't even pay attention to it. Don't even say, so are you going to stop yet? Don't say anything, and they'll realize they're not getting attention from it. A 2-year-old has difficulties in activities, has sensory sensitivity, has only spoken one word responses. How can you assess a child like that? A 2-year-old should be able to play. They like to touch and feel and be around things, and they can speak multi-words and small sentences. So how do we go and evaluate that child? And this child probably is autistic, especially that sensory sensitivity. They don't like to be touched. They don't like lights. They don't like bright noise. They don't like a lot of people around them. So this child we're going to assess with a modified checklist for autistic toddlers. And there are different sort of checklists for many different types of children, but that's one for that. Parents are concerned her 8-month-old child's not developing like her older child. So what is normal for 8 months? So they should be able to sit alone unsupported. Pull themselves to a sitting position, not necessarily, but you can put them in that position and they'll sit there. What fine motor skill is expected of a 4-year-old? Fine F fingers, okay? Now you know why I'm telling you that. There's gross motor, get up and go, go, go. That's movement. And fine motor is F fingers. And they should be able to button a shirt at 4 years old. The other stuff, a lot of it is gross motor. Skipping is gross motor, and walking up the stairs, that's gross motor. And tying shoelaces is not till 5 or 6 years old. I'll multi-select. What gross motor skills should a 4-year-old be able to do? So they should be able to walk up the stairs using both feet, and that's before age 3. Tying the shoelaces, I said no. Jumping rope, not yet. That's again older in age, 5 or 6. But hopping on one foot is actually a big deal. So it's walking up the stairs and hopping on one foot for those gross motor movement. Get up and go, 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 fine motors, gross motor skills. Car seats can be safely switched to the forward-facing position at what age? I had a hard time with this. My grandson only weighed 24 pounds at 2 years old. He was a peanut. So what do? Well, because their motor skills, their muscles have built up, you can safely change it at 2 years old. RNs doing developmental screening on a 10-month-old should expect which fine motor skills from this infant? Fine, F, fingers. So building a block tower of 2 is 12 months old. Objects, putting things into a container, 11 months old. Same thing for that one. So grasping a rattle and using that pincer grist, they should be able to do that at 10 months old. Frequent developmental assessments are important for which reason? Like, why do we need to know all of these things? Why do we need to know how much they should weigh, what movement, fine motor, gross motor? Why do we need to know these things? So we know if they're not doing what they're supposed to do, we need to find out why. And in the meantime, we can always institute early intervention. Children are so resilient. They catch up so quickly. So the earlier we give early intervention, occupational therapy, speech therapy, physical therapy, the quicker they will catch up, because sometimes that's all they need. I'll multi-select. An infant searches for her toy that is not in sight. What is this? Well, the first one absolutely is that object permanence. Even though it's not there, they still know it somewhere. But it helps with that memory because they have to remember that toy was there. It also is exploration that the parents, caregivers don't need to be there. They can do it by themselves. So it's one of the first things that they do by themselves is go looking for those things that they want. The natural physical developmental sequence that most children follow is what? So yes, the first thing is lifting their head up, rolling over front to back to front, then they creep, they crawl, they cruise, they walk. It's all in a sequence. And again, you don't have to do all the steps, but you have to be going forward in that. And then we know that they are cognitively and developmentally on point where they need to be. A multi-select, which would alert the nurse to hold the digoxin on an infant she's caring for. What do you know about digoxin? So we know a heart rate of 90 is too low. That'd be like giving an adult digoxin with a heart rate of 50. Digoxin levels are the same for adults as they are for children. And then of course, potassium, it needs to be at a normal level before we give it because it can cause dig toxicity. There's no such thing as bounding peripheral pulses and digoxin and why we wouldn't give it, okay? So heart rate, dig level, and potassium, just like adults. In general, an infant should triple their birth weight about what months of age? And if they don't, what would we do? So 12 months old, they should be tripling it. And if they're not there, we need to look at their nutrition, make sure that they're getting enough, and do other interventions to make sure that they're going to be catching up. When an infant toes spread with the soles of the feet are stroked, this is called what? And it's the same thing as adults. And it's called Babinski. You go like that and the toes splay. Rooting, you touch the cheek and the infant goes that way looking for breast or looking for a bottle. Startle is loud noises. Clap your hands or you bang their isolate and you'll see them jump, their hands and their feet come up. And we know that grasping, it's either reflex or voluntary grasp. When entering an infant's room, the door slams shut and the infant jerks and starts to cry. What is this reflex called? And all of this showing that our nervous system's doing what it needs to do. And it's called moro. It's a moral response. A startle or moro is the same thing. A 4-year-old is reluctant to take their medicine. What intervention should the nurse take? This isn't uncommon at all. Many children don't want to take their medicine, and many parents suffer trying to get these kids to take it. So never, ever mix the medicine with food, juice, or milk. Never put it in a bottle. They don't drink it all. How much medicine did they get? Unless it's a tiny little bit in a spoon. That's it that I would mix it with, okay? The best thing is to say, okay, you need to take a medicine. Would you like a pill to chew or would you like liquid? You want it in a cup or you want to squirt yourself with a syringe? Straightforward. Only give them those choices. Let them have choices, but make sure that, you know, they choose one. This is what the textbook says. Not always that easy, and we know that. Which intervention helps a hospitalized toddler feel a sense of control? So again, they like those rituals. They like that routine. They like the sameness. So feeding, nap time, bath time, foods, keep it the same. And that will help a toddler to be a lot less stressed. They like that control, to know what's coming next. An RN is assessing a 2.5-year-old toddler. What findings do you report to the provider? Like, which one of these is not right? So their height, that's normal. Their anterior posterior fontanelles, that's normal. Their weight, 4 times birth weight, absolutely normal. But if their head is still bigger than their chest, there's a problem and it needs to be investigated. Again, is it hydrocephalus? Is it a tumor? Why? There's something going on. A multi-select. What are risk factors for SIDS? So actually breastfeeding has been shown to decrease the amount of SIDS deaths, so absolutely not breastfeeding. But gender, males are more apt than females. Any smoke, secondhand smoke can cause it. And if they've had some sort of viral infection, those 3 things are absolutely those risk factors. What does the rooting reflex enable the infant to do? What did I tell you about rooting? Stroking the cheek. And it allows the child to go to the breast, latch on, or go to the bottle and start eating. Yes, very good. A multi-select. A child's been admitted with profuse diarrhea for 2 days. What would you expect? I'm going to be throwing in some of these acid-based questions throughout this weekly Kahoots. The last NCLEX and the last HESI had several questions on these sort of things. Is it metabolic acidosis, alkalosis? What is it? Well, if you're losing fluid, number 1, you're going to lose potassium, so hypokalemia. When a child's having diarrhea, because of all the enzymes used for digestion, those are alkalotic. So you're losing alkaline. So it is metabolic acidosis. You're left acidic because your alkaline has gone away. So potassium's low and you're in metabolic acidosis. Very good. An infant unable to take a breast or a bottle for feeding, what's important to remember? Remember, we have to keep up with the growth and development of these children, and what do we need to do? I mean, you see this infant here in the picture, they've got a tube feeding, so they don't need to suck to eat. And there's some conditions where they can't eat. So if a child cannot eat for whatever reason, you're not going to put anything in their mouth of due care or put formula in there. We're going to give them how do they soothe themselves? How do they de-stress? It's by sucking, right? So give them the pacifier. That non-nutritive sucking calms them down. And it's good part of their growth and development because that's what they do for the first, how many years? Everything in their mouth. When does an infant start? What does an infant start to do at 3 months? So they're going to be starting to be able to roll over. So they at least should be going front to back and then later on back to front. They're not crawling till about 6 months of age. And then jumping, well, it's not until they're 4 or 5 years old. And last question, an infant's first form of communication is what? And that's crying and cooing. According to the book, that's those exact words they say. So here we are, week 2. Let's see how we did. Number 3, Megan. Good job, Megan. Number 2, Elizabeth. Good job. Number 1, M. Number 4, Marjorie and Kai. What I want you to do is sign your attendance attestations. Please do not forget them, because remember, these are your point of contact within your Canvas shell. You have a quiz due after class. I always suggest, if you've listened well, done the Kahoots, you're ready for your quiz. I wouldn't do a quiz until you come to class, okay? Because I've gone over the information now, so you can go ahead and do it. I've made sure it's covered in one way or another, whether in the PowerPoint or in the Kahoots or within both. So you have that information. And you also have a discussion question. I will have your discussion questions probably back by Wednesday with some comments on it so that you can understand what you need to do for APA, or just a comment to say, okay, you know, or nice sharing whatever information. So thank you, everybody. Have a good afternoon. And if I can help you, just let me know, okay? Questions?
Thank you.